Officials in Columbia and Boone County today issued a stay-at-home order effective until the morning of April 24th, a full month. KRCG 13's Mark Slavitt is in Columbia to explain how that order works.
Columbia and Boone County leaders say their stay-at-home order helps ensure that the maximum number of people stay at home to slow the spread of the coronavirus. The order also allows essential services to continue. All business and operations except essential business and operations must stop. Restaurants and retail food establishments may provide pickup, drive-through, or delivery service. As outlined in a previous order, all public and private gatherings of more than 10 people are prohibited, unless exempt by the terms in the order.
Distance is the best defense in our fight against COVID-19. While pausing non-essential business, this order allows critical infrastructure and essential activities to continue.
The only known effective way to slow down or stop the spread of the coronavirus is to avoid being close enough to someone who is infected or who is a carrier so that it won't be transmitted to you.
All playgrounds will be closed to reduce the potential spread. However, public outdoor recreation areas remain open.
You can still go outside and take a walk. You can ride your bike. You can use our trails. You can exercise. But you need to try to keep some distance between you and others. You can still use essential services and businesses like the grocery store, the pharmacy, a healthcare facility, a convenience store, a gas station. Just remember, keep the distance between you and others while you're in these places.
The Boone County stay-at-home order indicates violations of any provision of this order is a crime punishable by a fine, imprisonment, or both.
Public Safety Director Sandy Karsten says the Parson administration has redirected $18 million from other programs across 3 state agencies for the purchase of personal protective equipment. KRCG 13's Kyrion Lee joins us live to tell us how the state is working to make PPE readily available to first responders and healthcare providers.
Yes, Karsten says access to personal protective equipment has been the #1 issue regarding COVID-19 in the state. So she says those redirected funds will help toward meeting that critical need for PPE for personnel. She says today the SEMA fiscal and operations staff placed orders for a total of $17.3 million worth of PPE. Karsten says the single most requested item is N95 respirators. In response, she says the state purchased more than $4.2 million in N95 respirators at a cost of $10 million. At the same time, Karsten says they're encouraging their response partners to purchase PPE directly themselves when they have an opportunity to acquire it through their commercial vendors and to keep all their purchase documentation.
We're also working to acquire everything from gloves and surgical masks and gowns to disinfecting wipes, hand sanitizers and goggles to biohazard bags. At last count, our SEMA staff has placed orders for 61,000 safety goggles, 95,000 3-layer surgical masks, over 7,400 surgical gowns, and over 335,000 bottles of hand sanitizer and many more PPE items.
Services for Independent Living has always coordinated volunteers to go grocery shopping for those who are just not able to. Here are a few examples behind me, but they're asking for help now more than ever. The program allows seniors or disabled people who are receiving the service to either go online and pick out their groceries or write up a list on their own budget. Volunteer then goes shopping at either the food bank or grocery store and drops off their groceries. But because of COVID-19, they're having to make a small change to the final step of the process.
So in our normal service, the volunteer would go in and help them put it away and stuff like that, but to minimize the risk for both the volunteer and the senior, we want it to be the least in person as possible. So leaving it at the doorstep. If you need to be in person, making it a brief interaction and keeping that good distance.
Anderson says the coronavirus has made this service essential to people with compromised immune systems, and they already have about 30 people who have signed up to receive the service. To find out more about the services for independent living and how you can get involved, head on over to our website, krcgtv.com.